Radiation therapy is a type of cancer treatment. It uses high-dose radiation to target cancer cells. It works by penetrating the cell's nucleus and damaging the DNA. This slows the growth and eventually stops the cell from dividing. It is not an instant result kind of treatment. Often it can take days or weeks of treatment before DNA is damaged enough for the cancer cells to die off. The most common treatment is the external beam radiation. This is where a patient will lay down on the table and the radiation machine will move to the proper angle. The machine will send out a beam to the precise location. There are a few types of beams that can be used, including the photon, proton, and electron beams. The photon beam has the ability to reach tumors that are deep, but one negative aspect is that the beam will not stop after it has reached the targeted tissue and will continue through and then scatter. A second type is a proton beam, which is positively charged. These also have the ability to reach deep tumors. One major pro about the proton beam is that it does not scatter and it will stop once it has reached the tumor. There are limits, however, due to the high cost of the machine and its large size. The electron beam, negatively charged, is typically only used for those tumors that are on or near the skin surface. There are also internal treatments that can be performed. Radiation is placed directly into the patient's body in capsules, seeds, or ribbons. With this type of treatment, the patient will emit radiation for a few days afterwards. Systemic therapy uses radiopharmaceuticals. An example is radioactive iodine, which is common for thyroid cancer. Another form of systemic therapy is targeted radionuclide therapy, which is also known as molecular therapy. Systemic therapies travel through your body, seeking out and destroying cancer cells. It can be given orally by IV or injection. Patients can have radioactive sweat, saliva, or urine following the procedure. Picking the right treatment differs case by case. Doctors have to look at many factors, including the patient's age and health, along with the size and location of the cancer. The therapy can be used as a primary treatment or in combination with other treatments. Some patients may be able to continue on with work while others may not. Special diets might be required due to nausea or even mouth sores. The unfortunate side effects, just like with all other treatments, can include hair loss at the treatment site, skin irritation, fatigue, dry mouth, nausea, or vomiting. As always, the benefits must outweigh the risk.